My name is Miranda Roach, and I am the Clinical Coordinator Learning Manager for the Paramedicine programs. Well, the Paramedicine program is divided into portions. The first 3 months you're in the classroom doing bookwork and didactic. After that you go to the hospital for a month, and then you go for an observation portion on the ambulance for a month to see if you like it. And if that goes well, then you come back to school at the end of January and you do another month and a half to 2 months of bookwork, and then you go to the ambulance for your OJT for a couple of months. And then after OJT, you graduate the program. It's a 10-month long program. So it's a lot of information compacted into 1 year. The main skills that you learn is how to assess vital signs, how to care for patients when they're in a crisis, how to lift. You learn how to use heart monitors, you learn how to do IVs, you learn how to work with hospital staff and fire departments and police. You learn how to use backboards and trauma equipment. You learn all kinds of things. The program's 10 months. It starts in September and ends in June. Well, a typical day, you start at 9 o'clock in the morning and you come into class and you do an hour and a half of class. And then you have a break, and then you do another class of a different topic, like a pharmacology course, say. And you would do an hour and a half of that, break for lunch, and then come into the afternoon for the same portion. There's a lot of group-based work, and there's also a lot of lab skill days as well. So like once a week you would come dressed in your uniform and you would come into this scenario here, like the ambulance, and you would work and do scenarios, real life scenarios. Like we have paramedics that are trained that come in and they run skills lab, and it teaches you everything that we went over earlier in the day on the basics of being a paramedic. You can have a career on the ground ambulance. There is some opportunity to work in a hospital as well. Just depends on the province that you're going to work in. The demand right now is the primary level, not as much as the advanced level. It just comes in waves, actually. The primary level there's a lot out there. There's already a lot of trained, so they're not needing as much. The advanced care program is newer, and they're looking for each province to have a certain amount of advanced care level paramedic on the ambulance. So they're trying to meet that mandate within the government. So they're looking to hire advanced care paramedics. Somebody who likes the medical field, likes dealing with people, wants to help people. Also, anyone who has the interest in being outside, like sometimes you're out in the worst of weather, storms, not for car accidents and stuff necessarily, but out helping people who need to go to the hospital, who are sick, who can't get in by car. That's an important thing. And also somebody who likes change. It's always different. It's never going to be the same. 2 calls are never the same. There's always different patients or different scenarios going on. So it's somebody who likes that fast-paced lifestyle. The main piece of advice that I would give is make sure that this is something that you want to do, and work hard if you want to do it. It's a very rewarding career. So if it's something you want to do, go for it. It's very difficult and it's a hard course to get into, and once you're in, it's very hard to keep up with the course load, but as long as you stay on top of it, it's definitely a good course to come to. There is work out there for paramedics, and it's a very rewarding career. So I suggest that anybody that likes this field of work should come and do it.